Filler can look amazing or make you look completely different. When volume loss ages your face, knowing when to use filler and when to walk away makes all the difference. In today's video, I'm going to show you exactly where filler works, where it fails, and when you need something else entirely. Hi, I'm Dr. Amir Karam. I'm a board-certified facial plastic surgeon and founder and creator of Karam MD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. So what's actually happening when you lose volume in your face when we age? Your face isn't just sagging, you're losing fat in specific areas. Fat pads deflate and migrate downward. This results in hollow temples, sunken under eyes, and even flattened cheeks, and a loss of volume around the mouth. Some of the volume is lost, some of it's actually displaced. That's why just adding filler everywhere doesn't work. In my practice, I perform a procedure called the facial fat transfer in conjunction with my trademark vertical restore facelift. Putting these two types of procedures together is what gives the face that natural facial rejuvenation that helps my patients look decades younger, but still like themselves when they're ready for a lift and when they're ready to do something to look as young as they feel. But it's not always easy to find a surgeon with facial fat transfer expertise, and it's not always the best first choice for younger patients looking to regain some volume in specific problem areas. So depending where you are in your journey, you might need one, the other, or a little bit of both. And by the way, if you like videos like this discussing how the skin ages and how to rejuvenate your skin and your face, make sure you hit subscribe. I upload a brand new video almost every week, and I want you to enjoy it and be a part of it. All right, so let's talk about where fillers actually make sense. There are 4 places where a little filler can be perfect. And after 20 years of doing these procedures, I feel like I have a good grasp on what the benefits of using this particular tool in the toolbox are, as opposed to just taking a blanket approach, which is fillers are bad, fillers have issues, fillers aren't great, but I'm going to explain specifically where these are quite good and maybe even better than the alternatives. So number 1, lips. Fillers work great here. Why? Because fat transfer doesn't really stick in the lips all that well. In fact, because of all the movement and chewing and talking, the new grafts just simply don't take in the lips the way they do everywhere else. So a little bit of filler here, completely fine. In fact, I think for people who want that little bit of augmentation and aren't going under any other type of procedure, filler is the perfect choice for a little bit of rejuvenation in the lips. Now, where I'm not a big fan of it is if you're trying to really augment the lips and make them look cosmetically bigger and frankly not proportional to your face, you're not gonna love it there. In the long run, this could cause some issues as well. I was gonna say not to mention raise some brows, but that's a different treatment. On to the next one. Number 2 is under eyes. And I think if you're dealing with a little bit of hollowing in the tear trough region, but there's no sagging, there's no bags, there's no excess skin, you're on the younger side, you just got a little bit of hollowing and it's really confined to just the tear trough and not all over the orbital rim and around the cheeks, etc. A small amount of filler placed correctly under the eyes can work well in this area. In fact, it's probably one of the best choices because it's controlled. It's not going to create a lot of the issues related to Tyndall effect and swelling and bogging because the volumes are small. And when I mean small volumes, I'm talking about literally 0.1 to 0.2, maybe 0.3 cc's of a filler. And the ideal filler for this area is something that doesn't pull so much water. Generally speaking, Restylane is a better product than Juvederm. Juvederm for sure is a nightmare under the eyes. If you're gonna do anything, I think Restylane is a pretty good product for that. Now, I know there's a lot of other products that I'm not even currently up to speed on, but generally speaking, you want something that doesn't attract a lot of water. That's the key. And that's why when I was injecting under this region, I was always using Restylane instead of Juvederm. Another caveat here is this is not a place where you want to keep coming back to. So really just maybe once or twice is needed. And frankly, this stuff lasts a very long time under the eye. So this is not something you should be doing on a regular basis. Now, if you overfill this region, you do risk the Tyndall effect. And the Tyndall effect is that bluish, almost brownish discoloration under the eyes. I can spot it from a mile away. The second I walk into a room, I know somebody has put filler under their eyes because of this kind of bluish, greenish, almost brown discoloration that happens under that region. Now, if this were to happen, you always have a recourse if you're using a hyaluronic acid product. So you can use a little bit of hyaluronidase, which is an enzyme, to get rid of the filler altogether and get rid of the Tyndall effect and that kind of boggy swelling that can happen. Number 3, the temples. A little filler for the temple hollowing can work very, very well. So the reality here is that the temples lose a little bit of volume. They can lose that volume at the level of the bone, which is the deep fat pad, or they can lose it in the superficial compartment. And putting a little bit of filler in this area can bring back a more youthful shape to that upper third, but you can't use too much here also. And you should also be aware that using filler in this area can be very tricky from a risk point of view because there's a potential to inject those veins. And there's a lot of veins around this area. So too superficial of an injection into a vein can cause some serious complications related to potentially blindness, in addition to a number of other end circulation issues of necrosis, etc. But the real concern here is blindness. So I always say, for sure, if you're going to be injecting anywhere around the eyes, make sure you're doing it with somebody who really knows what they're doing and is really aware of the anatomy. This is not a light procedure to be performed. In fact, I think Sculptra is a better solution for the temples, and we're going to talk about Sculptra in a moment here. It's a great solution for deep injection and keeps you out of the range of the veins a lot more reliably than injecting superficially with filler. But again, if you're doing this 3 or 4 times, you're probably, outpacing it, because the fillers in this region, same thing with around the lower eyelids, they actually last a very long time. So really this should be like a once or twice injection type of an area and just sort of living with the changes at that point. Number 4 is a post facelift boost. So the other area I recommend or advocate for filler use is the sides of the mouth. A lot of people have this kind of deepening fold. It's not quite a marionette, but it is a fold that starts to form in the corners of the mouth, these grooves around the oral commissures. And post facelift, a lot of times that doesn't go away. And I think it has a lot to do with the fact that the entire facial structure, the bones of the face are actually involuting a little bit and losing some of that bony volume, which makes the lips and the mouth kind of have a little bit more of a reset look. And this area is a nice area to very targeted place a little bit of filler. So fat transfer, you can't really put much of it in this area because it could be lumpy, bumpy, and a little bit of filler can work quite well in the corners of the mouth after a facelift. That's it. Those are the main spots that I think filler actually works pretty well. I guess if you were going to be a little bit more comprehensive with it, I think if you're very early in the aging process, a little bit along the pre-jowl region, which is right along this part of the chin, can also be good, but be careful if you have jowling, meaning that the jowls have come down and it's causing this area to look sunken. Trying to camouflage your jowl will mean that you have to put a lot of filler into that area. And in general, I'm not a fan of putting too much, but a small amount in this region can also be good. So call it a bonus number 5. All right, so let's move on to where fillers fail. Now, here's where people get into trouble with filler. So number 1, never use filler to lift the face. It's a complete myth and a complete failed endeavor, a misadventure. Filler doesn't lift, it adds volume. If you're trying to fight gravity by adding weight, it will backfire. Trying to lift with a filler creates that heavy, really weighted down look. It gives you more heaviness and fullness when the displacement of the tissues is causing it in the first place. So it actually adds fuel to the fire. Number 2, never use filler everywhere at once. If you're putting filler in your temples, under your eyes, your cheeks, your jawline, in this notion of a comprehensive volume loss treatment, that's not a filler situation. That's a fat transfer situation. Frankly, if you need to put it all over the face all at once, that means you're pretty far along the aging continuum, and putting filler everywhere all at once is a recipe for deforming the face, making the face look different. And I'm not a big fan of that, as you know. You've heard me talk about this before. Light touch with filler is good. Too much filler, not a big fan. Plus, it's a lot of burden on the tissues to have that much foreign body added at once. And in fact, this is the reason why people end up with the pillow face deformity, trying to solve big problem with lots of small solutions. So number 3, cheek placement problems. Many unexperienced injectors, and I mean this not in a negative way, but really this all came down from top down. The most experienced injectors, the mentors and the teachers, they were hired by the filler companies, were talking about using Voluma basically as a way to lift the face by putting a lot of it into the cheeks. And the fact of the matter is, this is a recipe for disaster. So in my opinion, injecting is a common mistake because placing it too high or too forward in the cheeks is where you start to form different looks to the face than you never had. Remember, at the end of the day, this is all about making you look like you used to. But the fact of the matter is most people didn't have that much cheek volume. What happens with age is the cheek falls and makes the face look empty. But if you just simply put your fingers here and lift up, you'll see that you bring that volume back to the cheek. And if it was brought back, you wouldn't have needed the volume in the first place. So by adding a lot of volume, you're putting volume in a place that never had that much volume. And that's where you get this kind of weird mid-facial fullness. Trust me, I've done it myself. I used to put fat in this area. I used to put filler in this area. I literally never use it there anymore because I didn't like the way these faces looked. And more importantly, I didn't like the way they aged. And I didn't like the way they looked after a facelift. So my whole paradigm towards volume in the cheek has completely changed based on observations and experience. All right, so let's move on to the weight problem. We gotta remember, fillers are foreign bodies. No matter how you think about it, hyaluronic acid in its free form is natural in the body. Hyaluronic acid that is chained together through a polysaccharide macromolecule is not natural. It does not exist in our body normally. And that is why fillers can actually last quite a long time in the soft tissues because they are technically foreign bodies and your body has to break it down. If you were to inject true hyaluronic acid into the tissues, it would last no more than a day, maybe two, before your body basically recycled it. It's not a filler when it's free, but it's a filler when it's used in this bioengineered molecule known as a filler, right? Okay, so keep that in mind. And like any other foreign body, first of all, your body wants to respond by breaking it down, but secondly, it has weight associated with it. And hyaluronic acid in general absorbs and attracts 1,000 times its weight in water. If you think about it, it's a very, very good sponge. So water attracted to the tissues makes the tissues heavy. So over time, multiple syringes in multiple areas weigh down your tissues visibly and also structurally. So a little filler strategically placed, completely fine. But when you keep adding more and more, you're creating a problem you're trying to actually fix. And that's no solution at all. All right, so the Sculptra question. I know what you're thinking. What about Sculptra and Radiesse biostimulators? So I've been using Sculptra for over 20 years. I like it. I think it's a good procedure. I don't do it currently anymore, but our nurse in our practice, she does do it. And I think it has its indications, but it has to be done in the right way. So here's what people get wrong. And I think this is really important to wrap your head around. They think it's a skin treatment because recently there's been this talk about the Sculptra glow and, synthesizing collagen near the skin, etc. Yes, it stimulates collagen. We've known this for years. This is what Sculptra does. The L-polylactic acid is a stimulator of collagen production. But here's the caveat. Even though the studies show it can improve the skin near where it was injected, but if Sculptra's primary role is volume restoration, and it's supposed to be injected deep in the subcutaneous or just above the bone, you will get stimulation in the adjacent tissues. But if you purposely try to inject it near the skin, yes, you're going to get that collagen synthesis. Yes, you might get an improvement of your skin. But if you keep injecting it into that area, you're also going to get volume. And this is the part that doesn't make any sense to me. And I don't know why people, in the new sort of paradigm in Sculptra injection, why people don't quite understand this. There's better ways, safer ways to improve the quality of your skin than to inject something that's going to add volume over time. So One time, I'm totally down with it. But if you're gonna be doing it on a regular basis, thinking you're improving your skin with this, you're gonna get puffy looking and you're going to get deformed looking, and it's not a good look. And it also makes future surgery very difficult for surgeons like myself who have to dissect through that scar tissue that the Sculptra creates, because at the end of the day, Sculptra collagen is scar tissue. Now, here's the caveat. If you're trying to improve your skin with it, well, you can't inject it everywhere. I mean, there's no argument about this. You can't inject it around your eyes. You can't inject it in your forehead. You can't inject it near your lips, because these are areas that are off limits, and they're off limits for a reason. They form little beads and balls when they're injected too close to mobile areas like muscles. So when the muscles are moving, even if you hyperdilute it, you still run the risk of it. So any experienced injector, again, 20 years of injecting it, etc., the rules don't change. You inject it too close to these areas, you run the risk of it having irregularities. So most good injectors might use it in the cheeks and the temples, but this strip here is getting improvement in skin, not everywhere. So all of the rest of the skin is basically not getting any improvement in skin quality, even if you're going to use that for that reason. Now, skincare, lasers, chemical peels that can treat the entire face, that's how you improve your skin, right? So if you're chasing, skin improvement through repeated Sculptra injections, you will see an increased volume of your face, and that's not necessarily a welcome change. So eventually you will overdo it, your face changes shape, you will lose that soft, subtle definition, and that's not a good thing. Especially, remember, because you're injecting in here, so you'll lose the shape of your cheekbones because there'll be no difference between the height of the cheekbone and the height of this region just below it. That's too high of a price to pay just to get a little collagen. And I love collagen production. So in my experience, there are more effective ways, more reliable ways to stimulate collagen than repeated Sculptra and Radiesse injections. I've done videos on Sculptra in the past, but if you wanted an updated deep dive, just let me know in the comments. All right, so now let's switch gears to fat transfer. So when do you need fat transfer instead of filler? The average person is somewhere in their late 30s, early 40s. I think of it as when you have comprehensive volume loss. You have multiple areas that are affected, like the temples, under eyes, some regions of the preauricular region, around the mouth, all these areas. And maybe you've tried some filler already, you're not quite satisfied, and you don't want to keep up with this doing it over and over again. And more importantly, you don't have any facial laxity, and I'll talk about why that's important in a moment. And especially if you're spending like $2,000 to $3,000 to $5,000 or $6,000 a year on fillers, that's when fat transfer starts making financial sense as well as a lifestyle sense. I mean, who wants to constantly get injected every, 6 months or whatever? Now, let me just point out, my wife was 36 when I did a fat transfer on her. Netta lost a lot of volume right after pregnancy. And we we looked at each other and say, wow, what a difference in the volume status. And we had 4 kids together. So as soon as she was done having all the kids, we did a fat transfer. And that fat transfer at the time literally was the only volume she got in her face, minus a little bit, maybe lip injections, maybe a fine line here and there, a handful of times over a 15+ year period. And then when she got to around 51, 52, she was ready to have the vertical restore and did a touch-up of the fat transfer in areas that I didn't treat before. But most of her volume that she had for the 15+ years, from 30-something until 50-something, was all from the fat transfer. It was a freedom that she had. She loved it, right? Not needing constant injections and all the bruising and everything else that comes with it. So there is a place. But if she had laxity, which many people do, they have looseness and laxity, fat transfer just doesn't satisfy the laxity. But if you are completely just looking for volume, it's a great treatment for it. But I don't do that anymore, where I treat people with laxity with fat transfer, because it just doesn't make enough of a difference to make the person feel great. And what I mean by make them feel great is make them feel like they got a true rejuvenation. But in somebody who's got just simple volume loss, it's the beautiful, beautiful treatment. Somebody like Netta at her age range. So let's talk about the difference between filler and fat transfer. Facial fat transfer uses your own tissue, right? It's basically called an autologous graft. It integrates naturally, just like any other tissue that's moved around in the body, whether it's hair, whether it's cartilage, whether it's bone, whether it's skin. If it belongs to you, your body wants to welcome it, but it technically has to be done right in order for that transfer to work. And the beauty of it is, because it's a natural part of your face, it works with your face. It integrates in the same areas. It's a deep injection in the same places where you've lost facial volume in the first place. So it moves with your face. It looks normal. It looks natural. But there's a lot of artistry involved in this. Like, you can't put too much in one area and not enough in another area. And this is where it gets a little tricky. So make sure you do your homework and look at lots and lots of before and afters before you pull the trigger on fat transfer. There's probably, sad to say, more cases that go wrong with fat transfer in inexperienced hands than there are cases that turn out beautiful. But as more surgeons are learning this technique and adding this to their repertoire, perhaps we're going to see better and better outcomes with it. But for now, make sure you are careful as you go forward. Overall, if it's done properly, if it's done well, and I want to make this point clear, I'm a huge advocate for fat transfer, but I probably have done more fat transfer than anyone on the planet. And I honestly mean that. I'm not saying this in a sort of bragging kind of a way. It's just, I've loved fat transfer since 2004. I've integrated it into my practice in a major way. Almost every day I'm doing a fat transfer. Every surgical case gets a fat transfer. I just don't know very many surgeons around the world who are doing it that much and that long. When it's done well, it's extremely low risk, both in terms of lumps, infection, etc., and it beats fillers in a lot of different ways. Here's some important points to it. It is a graft and it's a living tissue. So it takes immediately, meaning that it starts getting a blood supply. Some of it that doesn't get a blood supply is gone from your system. So this is what people don't realize, is that fat transfer doesn't diminish with time. You inject, let's just say hypothetically, 10 cc's. Well, let's say 5 or 6 of the cc's are going to get a blood supply. The other 4 to 5 is not going to get a blood supply. If the portion that doesn't get a blood supply right away, well, it's a living tissue. It's going to die and your body's going to absorb it. The part that gets a blood supply, it becomes integrated into your tissues and it lasts literally forever. So it's a permanent treatment, but there's a lot that has to go on in terms of how you harvest it, how you purify it, how you inject it, how much you inject to allow it to have that successful take rate. Even when it's injected, it does take some time to become active fat again, meaning that the process of taking sugars, converting it to fat, releasing the fat, just biochemically and biologically active, that can take 6 to 12 months. So sometimes you'll see a slight increase in volume at the 6 to 12 month range. And that's, it's a good thing, but it means that if you get a fat transfer, you don't want to get another fat transfer thinking that you're too diminished, etc., too early, because you could actually stack the fat and you end up looking too full later. And ultimately, I find it to be a beautiful and incredibly natural procedure, and I love it. But there are trade-offs. And what are the trade-offs? Well, number one, it's surgery. It requires an operating room. It requires sterile technique, which means it requires a downtime. Usually swelling can last anywhere from 2 to 3 weeks, sometimes longer, depending on how much fat is injected. And it can take a while to see the final result. So it's not instant gratification. And it's obviously more expensive than filler. It costs more upfront. You need to find an expert. You need to be very discerning about who does it. And then you need to kind of sit back and wait 6 to 9 months to see the changes that you ultimately will see. Even though the volume you might enjoy right out of the gates, there might be integration with swelling, which might give you an overfilled look, or maybe you like that overfilled look and now some of that swelling goes away and you're kind of looking at it saying, hey, I wish there was more. But something to keep in mind as you get this done, please, please, please keep this in mind. Do not wish for a perfect result with fat transfer, and don't push your surgeon for that. Please accept an underfilled look, because that's natural and that's normal. Plus, getting it wrong, if you overfill a face with fat transfer, remember it's permanent, you could be living with a overfilled area for the rest of your life. So I have reduced the amount of fat I put in faces over the last 20 years, not increased it. And I think the natural order of the face is to be slightly underfilled. And trust me, take a look at 20, 30-year-olds all over the place, and you'll see the majority of them are not perfectly filled faces. It's just too high of a price to get it wrong. Here's what nobody tells you. The person doing it matters more than what you're using. For filler, for example, you can get it at a strip mall or a facial plastic surgeon or a dermatologist. Med spas are sometimes unregulated. The directors are not necessarily doctors who specialize in these particular areas. So you have to be very discerning and you have to be picky. And ultimately, this is not like getting a haircut that has consequences. Bad filler can be dissolved, but you waste your money, your time, and sometimes even skin quality. But really, at the end of the day, there are real dangers involved in filler injection. There's necrosis, there's blindness, there's infection, biofilm. There's all kinds of things that people don't realize when they're getting fillers just haphazardly. They go to a filler party or a Botox party in someone's house, or go to, some place where it's, advertising it for, $50 less, and they go get it done. And unfortunately, there are some real consequences that happen as a result of that. So realize this is a medical procedure. So look for a board certified injector, whether it's their injector or the practice is under, the board certified dermatologist or plastic surgeon, facial plastic surgeon, and make sure you're in good hands, that they're doing things at a leveled up standard, and you're going to be safe from sterility and all the other things that are involved. I can't tell you the nightmare stories that I have seen personally from local practices, but also heard about through patient testimonials, and it's scary. Your heart goes. All right, so for fat transfer, now remember, this is surgery. This is not a lunchtime break procedure. It requires an understanding of facial anatomy, aging anatomy, youth anatomy. There's a lot going on here in terms of understanding. And remember, you're playing with a permanent procedure here. So where they harvest the fat, how they process it, where they place it, all of this matters, and all of it relates to the success of the procedure. So for this procedure, make sure you're choosing a board-certified facial plastic or plastic surgeon. And keep in mind that bad fat transfer is much harder to fix than bad filler. This point cannot be underemphasized. So while you're trying to figure out fillers and fat transfer and which approach to take with volume, let me talk to you a little bit about the things that you can control which relate to aging. That category is specifically your skin. You can't do much to prevent facial volume from diminishing other than not to lose a ton of weight, which if you need to lose weight, I would say lose the weight. It's better for your health and longevity and wellness and all this other stuff. But specifically, sagging and volume, those two categories of aging, they just happen. It's just part of aging. But when it comes to your skin, you can actually control it. So things like sun protection. Remember, UV light accelerates skin aging, maintaining stable weight, especially as you age, and avoiding this sort of yo-yo dieting, which definitely does age the face faster when it comes to volume loss. Smoking or vaping, this destroys volume in the skin, which accelerates the collagen loss and the subcutaneous loss. And getting started on a quality skincare that supports the skin barrier, stimulates collagen production, and makes the skin younger over time. That supple, thicker skin is going to play a huge role in keeping you looking younger. That's the part you can control. And this is really why I created the Karam MD trifecta. Many of you may know this, but just for those who don't, it's a 3-step anti-aging process. Rinse is the cleansing step. Quench delivers stable vitamin C, and Illuminate is this powerful all-in-one retinol, niacinamide, more vitamin C, peptides, and a number of other actives all combined to basically decelerate skin aging and improve the skin quality. So it's not replacing volume, but it's protecting what you have and keep your skin getting younger. So that when you do go in and get some of these other changes, you have a beautiful skin envelope to work with. And so many people don't put enough emphasis on that aspect of it. They do tons of filler, they do Botox, they do this, they do that, they go get surgery, but they're not taking care of their skin. And trust me, a young face has young looking skin, which is the surface process of the face, and they have young looking facial shape. So volume addresses shape, skin is the part that you're gonna see. So think about it that way, it's super important. And the one thing to keep in mind always, and I'm always gonna preach this, it's the consistent use of real anti-aging ingredients over time that creates the benefit. And that's really the promise. And that's the foundation of making the trifecta so easy so you can do it on a daily basis. So in conclusion, the decision framework. So this is what I want you to think about. So here's your decision framework in a simple way. Ask yourself, is it one small area or multiple areas that you're trying to treat? Am I trying to fix something specific or restore my whole face? Am I already on my third or fourth round of filler, or am I just getting started with it? Do I want something that lasts, or am I okay with maintenance and coming in every 6 to 12 months and doing more? This is my sort of decision-making tree. If you're younger and you have small specific areas, filler can work beautifully. Never to lift, never everywhere at once. Multiple areas, on the other hand, when you have significant loss and you're a little bit older, late 40s, early 50s and above, repeated filler, it's not going to be the treatment. In fact, it might not even be the right choice to do fat transfer, but fat transfer is a significant better treatment for global facial volume loss than is filler. So at least with a fat transfer, you're getting to do all of it. And another point here is that fat transfers are generally expensive. And why would you go in for just a small area or two? Wait till you need kind of a bigger area and then treat it all at once. And another point to keep in mind, and this is very, very important final note on this, is if you have laxity, jowls, neck laxity, midfacial laxity, etc., and you are hoping that you can use either filler or fat transfer to correct those problems, you're going to be very disappointed. That's where surgery comes in. That's not where volume comes in. So please keep that in mind. And that's really why these days in my practice, I literally don't do volume augmentation in any way for people who have lost volume in addition to their faces sagging. Those are the patients who get a vertical restore and a fat transfer at the same time. And then we have a beautiful outcome, a natural, satisfying outcome that meets expectation. I've gotten tired of people feeling like they do a fat transfer or fillers or whatever, and they still feel aged. And they have every right because the facial shape has changed. So you're not going to get that part corrected with any type of volume augmentation. All right, so comment below where you're seeing volume loss first, whether it's under the eyes, the temples, the cheeks, the mouth, etc. We're a community, we're trying to learn from each other. Share your own experiences with some of these procedures and let me know, are you leaning toward filler or leaning toward fat transfer? If you're ready for a deeper dive into fillers and non-surgical facial rejuvenation procedures, make sure you check out the Karam MD journal, which is linked below. And while you're there, make sure you sign up. It's a free weekly newsletter that breaks down skin anti-aging, skin health topics, as well as just wellness in general. Forward this video to anyone who you think would enjoy and like to learn about this. And if you haven't already, make sure you hit subscribe. Once again, thank you so much for watching. And until next time, Dr. Amir Karam.